So Dr. Cummings, perhaps you could just explain to us how the department started, given the fact that you were the first chair.
So throughout the 1980s, there was increasing interest both in radiation oncology and at the university in having an independent department of radiation oncology. Up until the creation of the department, we'd been not even a subsection of the Department of Radiology. We were just members of the Department of Radiology. There was no division of radiation oncology. There were two external reviews of the Department of Radiology. There was a separate committee struck by the dean, all of which recommended that there should be an independent Department of Radiation Oncology. The problem was that there was no money. The university was in a phase where they were actually consolidating departments and reducing departments rather than increasing in size. Fortuitously, towards the end of the 1980s, there were waiting list problems in Toronto and elsewhere, and the Ministry of Health was persuaded to put some money towards increasing the number of radiation oncologists. And the way that they chose to do that with appropriate prompting was through funding a department of radiation oncology at the University of Toronto. This would not have happened, however, because the amount of money that they gave was paltry, around about $420,000 total. But we fortunately got the support of the Princess Margaret Hospital and of the Ontario Cancer Treatment and Research Foundation, the forerunner of Cancer Care Ontario. And basically the department was set up, if you like, on probation for 5 years. And I was privileged to be successful in becoming the first chair of the department. The challenge for us was to show that we could be independent, that we could in fact function as a department on an equal footing with other departments. And I'm pleased to say that now that we're 25 years on, that we've been successful in doing that.
And now that we've heard that, Dr. Gospodarowicz, would you highlight some of the accomplishments I think that Dr. Cummings provided during his tenure?
Well, I think that when we started, the department was very small. There were very few radiation oncologists. And in fact, one of the big challenges was to increase the number of radiation oncologists. And if I remember correctly, under your leadership, we doubled or tripled the number of radiation oncologists in the city and therefore in the department. That was before we had community cancer centers with radiation oncologists. So in the 1990s, every single radiation oncologist in Toronto was part of the Department of Radiation Oncology at the University of Toronto. And there was a huge effort to growing education programs, and a lot of work was done in starting to integrate physics and starting to think about integrating radiation therapy. There were huge problems in 1990s with access to care. And I think that unified, strong Department of Radiation Oncology at the University of Toronto was crucial in developing sort of unified standards and academic standards of practice.
Yes, initially, as Mary says, that physics was, I won't say peripheral, but not a major player. And one reason for that was that physics, or most physicists at that time, saw their home academically in the Department of Medical Biophysics. The clinical physicists weren't terribly interested in academic appointments. And of course, radiation therapy at that time, we had a school of radiation therapy at Princess Margaret and a separate school at Sunnybrook. And it was, again, with what I'll call the second waiting list crisis of the late 1990s, that there was pressure to enlarge the number of radiation therapists particularly. And it was in 1998 that there was discussion, agreement between the university and the Michener that there should be and the radiation therapists, of course, that there should be a combined BSc diploma course. And this course was, I won't say orphaned, but it was hanging out there as to who was going to take responsibility for it. And a very able advocate of radiation therapists, Dr. Pam Catton, who was the head of education, was the one who persuaded me that we should accept the radiation therapy program under the aegis of the Department of Radiation Oncology. And I think even the dean at the time, Dr. Aberman, was a bit skeptical about it. And the Department of Radiology really was hands-off at that point. They weren't terribly interested. So the Department of Radiation Oncology accepted responsibility for the academic side of the program, and then it's grown enormously since then. Particularly, the first graduates were about 2002, but then under Mary's leadership, the role of the radiation therapist was greatly increased, and under both Mary and Fei-Fei, that's gone on to really prosper, and I think now is one of the gems of the Department of Radiation Oncology.
Dr. Liu, you were around while Dr. Gospodarowicz was head. Would you like to tell us some of the things that she did during her time that you think are noteworthy?
Right. So Mary had, under Mary's leadership, there was significant growth in the number of faculty. In particular, our physicists were incorporated and embraced significantly within the program, and many of our medical physicists, both at the Odette Cancer Center and Princess Margaret, became fully appointed at the university department. There was also significant growth in the number of radiation therapists who were also appointed, and in fact, it is one of the only departments, I think, in the world whereby our radiation therapists have full academic appointments. And now we have 35 radiation therapists who are now appointed to our university department, radiation oncology. So I think there were several important achievements under Mary's leadership. I think one is this fantastic interprofessionalism, which I think is critically important because this allows us the ability to be able to recruit and retain the best of talent. And when you have that academic ability to be creative, to be participating in research, innovation, and education and training, that allows them also then to fully develop the interprofessional care that we deliver at the hospital side. So I think that leveraging of the resources at the university and also at the hospitals, I think have been fantastic.
Dr. Cummings, given the fact that you have seen all this all these years, could you let us know what you think Dr. Liu has accomplished in this short time period and what you think the future holds?
Well, I think the main things that I'm seeing, in a sense, is consolidation of pre-existing programs and growth of those programs. These things they're not self-sustaining. They do require nourishment and curatorship. So we've seen education getting stronger. I think one of the great successes of what Fei-Fei's been able to do is to foster collaboration between, at the site group level particularly, between the two major cancer centers in the city. I think that's a very great idea. We actually had an attempt to do something like that in the 1990s, funded by what became CCO, and that really withered away. It was not successful. So I think that area, I think there's been the growth of the programs now into what I call the periphery of the Greater Toronto area. There's the continued growth of the international collaborations. Many of them started during Mary's tenure, but I think moving on now also with Fei-Fei's supporting and developing those further. When it comes down to a university department, there's always a sense of what is it that makes it a worthwhile department for the university. And primarily the university is interested in the academic activities. For a clinical department like radiation oncology, you can't actually separate academic activities from good clinical care. I think one of the strengths of the Department of Radiation Oncology has been that not only have we met the criteria of the university for faculty growth, faculty development, publications, research funding, but we have continually enhanced the quality of the clinical care which has been offered in radiation treatments here in the city. And I think people recognize that, and our peers recognize that within the hospitals that we serve. And without that, you have no future. And I think I would say not just Fei-Fei, but I would say that Mary has been successful in further developing that. Fei-Fei is, and I strongly believe that Fei-Fei will continue to do that.
You've been touting each other, which is nice. But now I'd like to hear what each of you think is the one thing that you're most proud of in regards to your contribution to the university department. We'll let Mary start because she's closest to me.
I think for me it was when people were presenting at CARO, the Canadian Association of Radiation Oncology meeting, and the attendees couldn't actually distinguish who was the radiation therapist, who was the radiation oncologist, and who was the physicist from University of Toronto who was speaking. The fact that we are in a discipline in the program that requires these three elements to work very closely together. I think we worked very hard so that each profession has their own academic career paths and opportunities for development, and having them all three contribute to the development and growth of academic radiation medicine is huge. And I was very proud that I don't hear anymore from physicists coming saying we have to be in Department of Medical Biophysics because that's the academic department. They are very happy to contribute to academic life in radiation oncology and work together. So I think for me, the sort of consolidation with what Bernard and Pam Catton started with, bringing physics, radiation therapy, and radiation oncology together was probably the thing that I'm most proud of.
Dr. Cummings?
Well, I think for me, the key part of my tenure was successfully negotiating those first 5 years so that the university didn't say, all right, this is not working. Because the end of that 5 years coincided with the move of Princess Margaret from Sherbourne Street to University Avenue. And if you like, the transfer of ownership, if you want to use that term, or leadership, to the University Health Network, or what became University Health Network. At that time it was Toronto Hospital. So we had to go through the whole process again of persuading the CEO of the Toronto Hospital that we were a department that stood alone, that had university status and deserved it. And we needed the support then of the Dean, and we were successful in getting the support of Dr. Hudson, who was the CEO of the Toronto Hospital. So I think to me that's the one thing that I remember. That was a very difficult period. There was an external review of the department. There were the recurring issues that come up with all sorts of external reviews, but superimposed on that was the fact that PMH at Sherbourne Street had been prepared to support an academic department of radiation oncology, and we had to get that support reaffirmed by UHN or Toronto Hospital.
So if I'm allowed to mention two things.
Current chair is always
Thank you. So I think the one thing is developing the collaborative program with all of our constituents. And so we have, in addition to the Princess Margaret and the Odette Cancer Center, we also have Southlake, our partners up in Southlake, and Barrie, and also the Trillium Health Partners at CVH. And what we've been able to successfully engage is actually all of the partners into this collaborative seed grant that I had launched in 2013 when I started. And so we actually have contributions from all 5 groups in terms of driving together collaborative research projects. And I think that would be something that I'm hoping that we'll be able to continue and to build collaboration amongst all of the primary partners and also our community affiliates. The second thing that I haven't quite finished is actually the redevelopment and transformation of the curriculum of the Medical Radiation Sciences program in partnership with the Michener, which is now at UHN. And so we've not been able to fully engage our imaging partners in the past, but actually in the recent year or so, we've actually been able to engage our Joint Department of Medical Imaging partners at UHN. And so they are now at the table with us, along with our Michener partners and with our university department, in redesigning the curriculum for our MRS students. And so that's something that I'm quite excited about, to be able to train graduates who are going to be market ready and have the hybrid skills of both treatments and also image literacy that's going to help them in their future careers.
Now that we've talked about all the accomplishments, can you maybe describe some of the challenges that you saw during your tenure and maybe some of the regrets that you would have done differently if you could?
Well, I'm actually very proud that you're in Toronto, because I seem to remember at some point in time you almost went to Hamilton. So I'm sort of congratulating myself that you're still here. I think that the challenges are always the same. The challenges are always funding. The challenges are, showing the university that we're value added. And there's certainly, as Bernard said, a movement to having fewer departments and making sure that we have our own voice and our own direction and we design our own future. Because I think it's very important. Radiation therapy is one of the fundamental elements of treatment of cancer. Everybody knows that. But with other elements that need to be looked after, such as diagnostic elements in cancer care, in the prevention, the early detection, screening, diagnosis, the whole progress that's occurred in pathology and imaging, and then systemic therapy and surgery. You have to design your own future while at the same time collaborating and respecting the other elements of cancer care, which, when you bring that together with radiotherapy, result in improving outcomes in cancer and better cancer control. So we're not the sort of solo player in that, but we have to make sure that we define our own destiny and don't only respond to what's expected of us, but also drive the progress in the future. So we need to engage internally. So creating the best radiation medicine academic research education programs. There's so much to do in the whole realm of modern training and education. It takes far too long to produce us, to train us. We have to do things differently. We did quite a bit of work globally to look at the gap in access to radiation therapy. Can we contribute as a leading department globally in research and in education to actually address these issues? So I think the challenge is always not only to manage the faculty and keep everybody happy and manage the finances, but also manage definition of our future. Who do we want to be and how do we want to contribute, and how are we from University of Toronto going to change the world?
I'll go to Fei-Fei now, because now that challenge is
Yeah. So I think as Bernard and Mary have both mentioned, there are always continuous challenges. I think resource continues to be a major issue in terms of funding. So Bernard mentioned a paltry $428,000 a year. That paltry amount has remained constant over the past 25 years, despite the fact that the size of our program has at least trebled, if not quadrupled. And in fact, as an aside, the Ministry of Health has recently come and asked us as to whether or not there's a possibility of removing that money and delisting us, as they call it. And so I think that would be extremely unlikely, because I think according to the original terms of reference of the expectation and the deliverables of the UTDRO, we have delivered way beyond what has been expected. And I think that our contribution in terms of being a hub of innovation and the ability to be able to disseminate that knowledge and expertise across the entire province, and then thereby allowing access of Ontarian patients to the highest quality and excellence in clinical care delivery, is very much have been predicated on the existence of the university department. And so I'm fully confident that our paltry funding will continue. And I think that in terms of the continuous challenges, I think that one of the many things I'd like to be able to complete in my second term is to focus, for example, on introducing the novel thinkings around radiomics and genomics, and really thinking about personalized medicine for our patients in terms of how best to deliver that. There are a lot of changes in the education curriculum, the competency by design in our residency program, and our our undergraduate medical education programs. I think there's a lot of opportunities there, and I'd also like to be able to figure out how we can actually fundraise much more effectively, because I think that's really a key to what I see successes for many other university departments.
You know, one thing that I didn't do in my term, I'm trying to do it after, is to increase our global engagement. And I think Fei-Fei is doing that through not only training opportunities, but also partnership. We see it more and more. University of Toronto has developed a number of global programs which we collaborate in. But I think as a department, considering the status of radiation therapy around the world, it's incumbent upon us to actually not only benefit what we have, but also to give and to contribute. And having that as part of our academic mission, I think, is very important in the future. Both Bernard, Fei-Fei, and I think, had the same quest that this is the best department of radiation oncology in the world, and we're close, you know. But then you have to ask yourself: so what is the characteristic of best department? Is it the best research? Is it, you know, developing the new paradigm of treatment? Is it our products, our residents, our trainees? You know, what creates this sort of, I suppose, environment that people will say, if I want to look at the example of what radiation oncology can accomplish, I'll go to Toronto to look. And I think that the sort of constant introspection and looking at that is very necessary, because sometimes you may just focus on education, sometimes you may just focus on research, sometimes you just can focus on clinical trials or working in ministry. I think as a chair, you need to be comprehensive. You need to look after all the elements that make a big academic department, which includes advocacy to the government, advocacy to the university, advocacy to the healthcare system, but also, you know, how do we transform the education of radiation technologists and physicists and radiation oncologists? How do we create a better product that then is far more effective in conducting academic practice and setting the example? So I think that you know, my thinking is that the department needs to engage all the members of the department. It's not just the chair or the executive or the people with titles of, you know, directors of the programs, but everybody in the department needs to contribute to that. We have many very talented people in the department. We've grown the department. The department is now what, 189, close to 200 people. That's a huge talent pool from which, you know, I think it's the chair's job to see how you can harness all this intellectual capital that resides in the department.
I think one of the challenges which certainly Fei-Fei is now facing is that as the department becomes more and more successful, you get your success in considerable part through your stars. Our stars are hot properties around the world. They can be recruited away. And the issue, I never believed this when I first started as chair, but I was told that I would have to spend 30% of my time on recruitment and retention. And I thought that that was excessive, particularly the way that we were actually structured within the hospital departments at a time when there was very little mobility. Radiation oncologists did not move from Toronto to London or from Toronto to Vancouver and things like that. And I don't know that any of us have ever thought of having to spend 30% of our time or more in recruitment and retention, but I think we're now starting to face that because we've got a cohort of outstanding faculty coming through and other people want them. So you've either got to keep them happy and keep them at home, or let them go, because they'll go anyhow, and make sure that you've got replacement. So there's a constant problem of having to be training, or encouraging in this case, replacements for those people.
I actually think it's a good thing. You know,
I'm not saying it's a bad thing, but I'm saying it's a real thing.
Because you can, I mean, when I started, there was always a problem that we were always short of radiation technologists, and part of the part of the certain paradigm in the hospitals was to retention, don't let anybody go. And we were producing, you know, dozens of very talented, bright, newly graduated radiation therapists. And I said, if I don't let anybody go, then I can't hire anybody. So actually some turnover is a good thing. And I think if we focus, if we accept that we produce superstars and they're going to be recruited and assume leadership elsewhere, then it's incumbent upon us to produce the superstars. And that's how you gain this, you know, paradigm of being the best in the world, because everybody trained in Toronto, and guess what? They're leading London, they're leading elsewhere, they're leading other places in the world. And, you know, that takes me to our alumni. We have dozens and dozens of either residents who went to work somewhere else or fellows who work somewhere else, many of them in leadership positions, very important leadership positions. They're still in touch. You know, if you go to Hong Kong, if you go to Australia is populated with Toronto-trained radiation oncologists, Ireland, UK, and I think we should keep in touch with this diaspora of people, not to lose this part of intellectual capital that we have produced, but to also harness them and keep them. And I think Fei-Fei has now a very active alumni program. So.
Yes, we do indeed, right? So we have 2,000 alumni in terms of the number of graduates who have completed our program and have gone through our doors. And so we actually host an ASTRO alumni event, which was started by Mary a few years prior to my starting. And we've continued on with that every single year at ASTRO. And it's hugely, and you've attended, many of you have attended those events, and they're actually hugely popular. And we think it's a fantastic way to keep in touch with our alumni. And the network is really quite phenomenal, as Mary says. You know, you go to these countries, go to Saudi Arabia, and you know we have our alumni there, and so it's really and they become collaborators in terms of collaborations on international clinical trials, and we invite them back to give keynote lectures at some of our conferences, and so it really is a fantastic diaspora, and they're very valuable members of our community. I think I also like to add that this is a really exciting department. I mean, we can see that there are people who really want to come to Toronto. We've been able to successfully recruit people from all around the world. And I also want to specifically acknowledge and thank Bernard and Mary for having created such a fantastic foundation for our university department. And I'm looking forward to us existing for another 100 years.
We'll all be here.
Yeah, of course, yes.